All right, so today we're diving deep into group therapy
Oh, yeah.
and really exploring the power of shared experiences in a therapeutic setting.
Love it. Should be interesting.
Yeah, and I was looking at this excerpt from a psychologist
Okay.
who leads group therapy sessions, and it really got me thinking.
Mm-hmm.
The excerpt mentions how important it is
Yeah.
to immerse yourself in dialogues.
Mm-hmm.
What does that even mean? You know?
I think when you're in individual therapy,
Yes.
it can sometimes feel like there's this sort of invisible wall between you and the therapist.
Interesting.
But in a group setting, when everyone's sharing their stories and their struggles,
Yeah.
you realize that you're not alone in those feelings.
Oh.
It's like the walls come down.
Wow, I like that.
Right. And so everyone is kind of immersed in this shared experience.
Yeah, that's really powerful.
Yeah.
I can see how that would make people feel less isolated.
Definitely. I think that's a big part of it, but it goes beyond just feeling less alone.
Okay, how so?
Well, the source material also talks about this idea of mutual support.
Yeah, I was going to ask you about
Oh,
that.
yeah. I mean, that's one of the most amazing things about group therapy.
Hi.
It's like having this built-in support network of people who truly get it.
So it's not just the therapist offering support. It's coming from everyone in the group.
Exactly. Imagine someone is struggling with anxiety.
Okay.
They might talk about their fears with a therapist, but in group therapy,
Yeah.
they have this safe space to practice social skills with people who understand what they're going through.
That makes a lot of sense.
It's like a real-world laboratory for personal growth. Because in a group setting, you're not just getting support.
Okay.
You're also learning from each other's experiences.
You mean like learning new coping mechanisms?
Exactly. Like
Okay.
someone might share a technique for managing stress that you've never even considered before.
That's like crowdsourcing solutions for life's problems.
Exactly. And not just practical solutions either. Group therapy can really boost self-awareness.
In what way?
Well, getting feedback from multiple people who see you from different angles.
Yeah.
It can really help you understand your own patterns and behaviors.
That's really interesting. I mean, do you have any like specific examples?
Oh, yeah. I mean, from the cases in the source material I was looking at,
Mm-hmm.
I remember there was this one patient. She was incredibly shy
Okay.
and just terrified of public speaking.
Oh, wow.
Through group therapy, she learned these practical techniques
Yeah.
to manage her anxiety, but she also saw others overcoming similar fears.
Interesting.
And that really gave her the courage to step outside of her comfort zone.
It sounds like the group became her cheering section.
Exactly. And that kind of support can be so powerful for people who are struggling.
It makes me wonder, though, wouldn't some people find it intimidating?
Oh, to share so openly in a group?
Yeah, that's what I was thinking.
Yeah. I mean, you bring up a really important point.
Mm.
Group therapy isn't a magic solution. It's not for everyone, and it definitely requires, a certain level of trust and commitment.
So finding the right group is crucial.
Absolutely. And having a skilled facilitator who can guide the group dynamics is essential.
That makes sense.
It's not always easy. There can be challenges and conflicts that arise within the group.
Right. It's not all sunshine and roses.
Exactly. But, when it works well,
Yeah.
it can be incredibly transformative.
It's amazing to think about how just sharing your story and listening to others can lead to such profound growth.
It's a reminder that, healing doesn't have to be a solitary journey.
So true. So to recap,
Yeah.
group therapy creates this unique space for growth through immersion in shared experiences and mutual support.
Exactly.
It can help reduce isolation,
Mm-hmm.
teach us valuable coping skills, and increase self-awareness. Finding the right group
Right.
and being open to the process is key.
Couldn't have said it better myself.
So for all of you listening,
Yes.
I want to leave you with this question. Could exploring your challenges in a supportive group setting unlock new levels of understanding and self-discovery for you?
It's definitely worth considering.
It might be a path to healing and growth that you haven't explored yet.
Yeah.
Let's think about it. Thanks for joining us for this deep dive into group therapy.
My pleasure. Always a good conversation.
Until next time,
Yeah, take care.
keep exploring.
What?
All right, so welcome in, everybody. Today we're going deep on language therapy.
Language therapy.
And we've got some really, really interesting source material.
Oh, yeah.
Yeah, so we've got what we have are actual dialogues between speech therapists.
Okay.
And so it's really kind of like eavesdropping on how they think and how they problem solve.
It's kind of like a backstage pass
Yeah, exactly.
to see what they're doing and how they think.
So I guess maybe the first thing to kind of get into is why are these dialogues so valuable?
Yeah, why not just, pick up a textbook?
Yeah. What do we gain from hearing these conversations as opposed to reading something that's, more
Sure. You
more
were-
formal? Yeah.
Yeah. Well, I think one of the things that really comes across is the dynamism
Okay.
that's involved in language therapy, and you hear the therapist responding in real time
No.
to their clients, and you hear them thinking out loud and kind of debating the best approach. Do we use this technique or do we use that technique?
That's interesting.
So it's a window into their clinical reasoning.
Okay. Yeah. Yeah. And I think that, one thing that really struck me as I was reading these dialogues was how creative
Yeah.
the vocabulary building exercises are.
Mm-hmm.
There was one where they were using a story about a mischievous monkey
Oh.
to teach kids new action words.
Oh, fun.
Yeah. And they even had the kids like act out the monkey's antics.
Oh, wow.
So I thought that was really cool.
Yeah, I mean, it makes sense if you think about it from an educational psychology standpoint.
Mhm.
When kids can see, hear, and even physically experience a word,
Right.
it just helps them remember it so much better.
Oh, so there's
Yeah.
a brain science reason behind that.
Yeah, absolutely.
Oh, that's really cool.
Multisensory engagement.
Okay, multisensory engagement. I like that.
Yeah.
And then, it wasn't just about vocabulary. They also had some really creative grammar exercises.
Oh, yeah.
Yeah, there was one that I thought was really funny, where they used these kind of silly sentences to practice verb tenses.
Okay.
So they were having kids say things like, "The elephant will have been brushing his teeth with a toothbrush."
Okay.
I was like, so ridiculous.
That's hilarious.
Yeah, but I guess it just helps them remember
It probably does. Yeah.
the different verb tenses
It probably makes it more fun.
and more memorable.
Exactly. Yeah.
And it made me think, even beyond language therapy,
Uh-huh.
like could we apply this to other subjects?
Oh, totally.
Like history class or math.
I mean, think about trying to learn history by creating memes,
Yeah.
using humor.
Oh, that'd be great.
You're going to remember that so much better.
Yeah, absolutely. Okay, so we've talked about vocabulary, we've talked about grammar.
Uh-huh.
What about comprehension?
Oh, yeah, that's a big one.
Yeah, so one of the things that the dialogues highlighted was this activity where therapists were using picture books to help children predict what might happen next in a story.
Oh, that's interesting.
Yeah.
I like that.
And I thought that was really cool.
Yeah, it's a good way to build those inferential reasoning skills.
Okay.
Getting kids to think about the context and the clues and what's going to happen next.
Like a little detective?
Exactly.
Yeah. That's fun.
And that's such an important skill, not just for reading,
Right.
but for life.
Yeah, like if you can figure out what's going to happen next,
Mm-hmm.
you can kind of be ready for it.
Exactly. And you can understand social situations better and you can problem solve more effectively.
Wow. So we've covered a lot of ground here. We've talked about vocabulary, grammar, comprehension.
We have.
It's amazing how all these different cognitive skills are kind of intertwined.
It really is.
Yeah.
And it makes you wonder, how much of our communication is happening below the level of our awareness.
Oh, interesting.
All these unconscious processes that are shaping the way we use language.
Yeah, and maybe that's something to think about.
Absolutely.
As we go forward, how can we tap into those unconscious processes?
Right. How can we use that knowledge
Yeah.
to be more effective communicators?
Wow, that's a great question to leave everybody with.
Something to ponder.
Yeah.
For sure.
All right. Thanks for joining us for this deep dive into language therapy.
It's been fun.
Yeah, I hope everybody learned something new today.
Me too.
We'll see you next time.
See you later.
All right, welcome back everyone for another deep dive. Today we're going to be talking about swallowing therapy,
Okay.
which might sound a little niche, but it actually covers some things that are super important to everybody.
Mhm.
Things like health, communication, and just, enjoying life.
Absolutely, yeah.
So maybe you can start us off by telling us, why is swallowing so important?
So swallowing, I mean, most people don't think about it. We
Right.
do it so many times a day without even realizing it. Just to stay alive, we have to swallow, right? For nutrition and hydration.
Of course, yeah.
But it also has this huge social component that I think sometimes gets overlooked. Sharing meals together,
Right.
having a conversation over coffee, all of that requires swallowing.
Yeah, I never even thought about that. That's a good point.
Yeah.
So what happens when that process is disrupted? What are the consequences?
Yeah, so when someone has difficulty swallowing, that's medically called dysphagia. And it can range from just like mild discomfort to being completely unable to swallow anything.
Wow.
And so, like you said, it's not just an inconvenience, it has real consequences. It can lead to malnutrition and dehydration, obviously, because you're not able to get enough food or liquid.
Right.
There's also a risk of something called aspiration pneumonia.
It's aspiration.
Aspiration pneumonia, yeah. And that's where food or liquid ends up in your lungs
Oh,
instead of your stomach.
that sounds serious.
Yeah, it can be very dangerous. And then, there's also just the psychological impact of dysphagia, the fear of choking, the frustration of not being able to eat what you want, and even the social isolation that comes from having to avoid meals.
Right.
Or changing your diet drastically.
That makes sense.
Yeah.
So who typically needs swallowing therapy?
Oh, it's actually a really wide range of people.
Okay.
So you see stroke survivors,
Yeah.
people with neurological conditions like Parkinson's disease, ALS, even infants can have swallowing difficulties.
Oh, I didn't realize that.
Yeah, sometimes it's due to premature birth or developmental issues.
It's amazing how something we do so automatically can be affected by so many different things.
Absolutely.
So tell me, what actually happens during swallowing therapy?
Well, it's really all about figuring out the root cause of the problem
Yeah.
and then tailoring a treatment plan to that individual. So it's very personalized. Some people might need to strengthen the muscles involved in swallowing.
So like a workout for your throat, basically.
Exactly, yeah, like physical therapy.
Yeah.
Others might need to work on coordination and timing, practicing specific swallowing maneuvers.
I see.
And then sometimes it's about adapting the environment, like changing food textures to make it easier to swallow,
Okay.
or using assistive devices.
So it sounds like a lot of work.
It can be. For both the therapist and the patient, it requires a lot of patience and dedication.
I can imagine.
But, it's really rewarding to see the results. I had this patient, she'd had a stroke, couldn't swallow anything but thickened liquids for months. But we worked together, and she was finally able to enjoy a piece of her daughter's wedding cake.
Oh, that's fantastic.
Yeah, those are the moments that make it all worthwhile.
Yeah, that's incredible.
It's not just about regaining a physical function, it's really about quality of life.
Yeah.
Helping people reconnect with the joy of food and just everyday activities.
That's so important.
It is.
What do you think the future holds for swallowing therapy?
Well, there are some really exciting advancements in technology.
Like what?
Biofeedback devices, for example.
What do those do?
So they allow patients to see and control their swallowing muscles
Oh, wow.
in real time, which is amazing. And virtual reality is also being explored as a way to create engaging and realistic therapy environments.
Huh. So it sounds like the future of swallowing therapy is very personalized and even more effective.
I think so, yeah. As we continue to learn more about this complex process, we'll be able to help even more people.
This has been a really fascinating look into swallowing therapy, and I think it's something that most people don't even consider.
Definitely.
So, for all of you listening out there, next time you're having a meal, or even just a sip of water, take a moment to think about what's going on in your body and appreciate the wonder of this incredible process we call swallowing. And before we go, here's a thought to chew on. Could we one day see personalized swallowing prosthetics or even gene therapy to treat swallowing disorders at their core? I think that would be incredible, and it will be interesting to see how this field continues to evolve. So thank you all for joining us on this deep dive into the world of swallowing therapy.
Thanks for having me.
Hey everyone, welcome back. We're diving into some really interesting conversations today all around fluency shaping techniques, specifically for folks who stutter.
Yeah, it's a pretty fascinating area.
And, from what I'm seeing in the material, it seems like less about like a deep dive into step by step how these techniques work, and more about kind of the discussions that are happening around them.
Exactly. And I think that's a really crucial point because, it's not just a matter of, here's the technique, go do it. It's more about understanding, the individual, the context, and how these techniques can be adapted, to each person's needs.
So you keep using this phrase, fluency shaping techniques. I mean, for someone who's listening who might not be familiar, what does that actually mean?
Sure. So when we talk about fluency shaping techniques, we're essentially talking about ways to modify speech patterns to reduce stuttering. There's all sorts of different approaches and techniques, but the overall goal is to help individuals speak more fluently.
So are we talking about things like, breathing exercises or I don't know, the way you move your tongue or your lips when you speak, that kind of thing?
Yeah, absolutely. Those are definitely some of the components. It can also involve things like slowing down your rate of speech, using more pauses strategically, or even adjusting the rhythm and intonation of your voice.
So it's really about finding the right combination of tools for each individual. It's not like a one-size-fits-all kind of deal.
Exactly. And that's where these conversations become so important, right? Because it's not just about handing someone a manual and saying, okay, here's the steps, do this, and you'll be fluent. It's much more nuanced than that.
That makes sense. It strikes me that the material we're looking at really emphasizes this kind of idea of like a personalized approach rather than just a set curriculum. Would you say that's accurate?
Absolutely. And I think that's one of the really exciting developments in the field. There's this increasing recognition that every individual who stutters is unique, and their journey to fluency will be unique as well.
Right, because what works for one person might not work for another.
Precisely. And that's why this whole idea of having conversations and really engaging in dialogue is so crucial. It's about, the therapist, the individual who stutters, their support network, everyone working together to find the best path forward.
So what kind of things would these conversations, like what would they actually cover?
Well, they could cover a whole range of topics, but some key areas might be, first and foremost, understanding the individual's specific challenges. What are the situations where they tend to stutter more? What are their particular fears or anxieties around speaking?
So really kind of getting a sense of their individual experience.
Exactly. And then from there, exploring their goals. What do they hope to achieve through therapy? Is it about, feeling more comfortable in social situations?
Mm.
Or is it about being able to give presentations at work without stuttering? Everyone's aspirations will be different.
Right, because for some people it might be, just being able to order a coffee without feeling self-conscious. And for others it might be, delivering a keynote speech.
Exactly. And, the conversations can also delve into, different types of fluency shaping techniques. Like there's a category of techniques called stuttering modification, which focuses on, helping individuals manage and control their stutters when they do happen. And then there's another category called fluency shaping, which aims to modify speech patterns altogether to prevent stuttering from occurring.
So it's like different approaches, different tools in the toolkit, and you're figuring out which ones are going to be the best fit for each person.
Exactly.
So if you were sitting down with someone, to have this conversation about their fluency, what are some questions that you would ask to make sure that you're really tailoring the approach to their needs?
Well, a really important one right off the bat is, what are your biggest concerns about your speech? That helps us understand their priorities and what they're most hoping to address.
Makes sense.
And another crucial question is, what do you hope to achieve through therapy? Because again, that really focuses on their individual goals and aspirations.
So it's about shifting the focus from a generic solution to something truly personalized.
Exactly. And I think that's really what this whole deep dive is all about, right? It's recognizing that fluency is a journey and it looks different for everyone.
It is, yeah. And these conversations are really the key to navigating that journey. So, as our listeners are kind of thinking about this topic, I want to leave them with a question. If you were designing a conversation around these fluency shaping techniques, what questions would you ask to make sure the outcome is as positive as possible for the person you're working with? Ever catch yourself just totally fascinated by how someone talks?
Like, it's not even what they're saying, but the way they're saying it.
Yeah, exactly. And that's what today's deep dive is all about. Articulation therapy. We're going behind the scenes to see how speech therapists help people refine their voices.
We've got all these real conversations between speech therapists. It's like
we're eavesdropping on their professional development sessions.
Exactly.
A real glimpse into how they think about and approach articulation therapy.
Yeah.
So for our listeners who are already pretty familiar with articulation therapy,
Right.
let's skip the definitions and jump right into the cool stuff.
Okay.
What were some of the aha moments from those therapist conversations?
Well, one therapist talked about using tongue twisters, but get this.
No,
They have their clients practice them in reverse.
them reverse.
Yeah, like focusing on each sound slowly and carefully.
Wow.
And they were saying they even saw improvement in the orbicularis or vis muscle.
Hold on, what's that?
It's the muscle around your lips that helps you round them for, it sounds like R.
Oh, so it's like reverse engineering the tongue twister to
Yeah.
really target specific muscle movements.
You got it. It's not about speed, but about making those tiny, precise articulatory gestures.
That's brilliant.
Right.
It's amazing how much detail goes into this work.
Oh, yeah. And another therapist was talking about using something called minimal pairs.
Minimal pairs.
It's where you use words that are almost the same except for one sound, like cat and hat,
Ah, I see.
to help the client hear and practice those tiny differences that make a big difference in how we understand them.
Smart. What about challenges? Were there any sounds that the therapist said were really tough to work on?
Oh, yeah, definitely. The R sound came up a lot,
Yeah, ours tough.
especially with kids. They were talking about how complex the tongue movements are
Right.
and how important it is to find creative ways to get kids excited about practicing.
It's crazy how something we do without thinking, like saying R, is actually so complicated. But I bet when a client finally gets it, it's super rewarding.
You know it. You could just hear the excitement in their voices when they talked about those breakthrough moments.
Yeah.
One therapist was describing this kid who had been struggling with stuttering,
Mhm.
and he finally gave a presentation at school without any stutters.
Wow.
The confidence boost was huge.
It's moments like that that must make it all worthwhile.
Yeah.
You're not just helping someone talk to you. You're helping them be themselves.
Yeah, exactly. And it makes you think about how much clear communication affects our lives,
Right.
our relationships, our ability to share who we are.
Totally. So to everyone listening out there, pay attention to your own voice.
Yeah,
Notice the sounds you're making, how you form words.
right.
Maybe even give that reverse tongue twister thing a try.
It's a whole world waiting to be explored.
It really is.
Thanks for listening.
And we'll catch you in our next deep dive.